1918 influenza or flu, a truly global pandemic. One of the leading reasons the 1918 flu spread so globally was World War I. This pandemic tended to kill people in the prime of their lives. The death total was greater than the death total of civilians and military deaths due to World War I. It killed 5 times more people between 20 to 40 years old than between 41 to 60 years old. According to Encyclopedia Britannica, there were an estimated 21.5 million military and civilian deaths due to World War I. The 1918 pandemic killed at least 50 million people. That is more than twice as many as one of the deadliest conflicts of all time. One of the reasons this strain of influenza was called the Spanish influenza is the fact that Spain was a neutral nation in World War I. There was no media censorship such as the Sedition Act in the United States. Spain was honestly reporting about its spread, other countries try to downplay it. In reality, it is believed that the Spanish influenza was brought over to Europe by American troops being deployed to Europe. One of the reasons that the flu became more widespread and deadly was due to close quarters in trenches, lack of basic hygiene, and that troops who had mild versions of the flu tended to stay in the battle. Only the critically ill were removed and sent home to be hospitalized, sending the deadliest strains back home. Even back then, people had ideas of how to avoid influenza's spread, such as mask wearing, hygiene, not sharing objects, and quarantine. Even back then, some people refused to listen. As you can see, not everyone wore masks as mandated. Anti-maskers were a thing back then too, just like in our modern pandemic. The Red Cross was seen and depicted as patriotic. The Red Cross provided much help and education during this time of crisis, both on the battlefields and at home, recruiting healthcare workers and volunteers to assist overworked and overwhelmed healthcare system. As a nurse who has worked in healthcare throughout the current pandemic, I can only imagine the amount of burnout they suffered. I worked in corrections during this current pandemic where 3 nurses, 2 med aides, and a PA were in charge of hundreds of sick inmates. In my county jail, we had many people confined into cells of up to 20 inmates. In those tight quarters, we worked tirelessly trying to keep COVID from spreading. We tried to fill cells with new inmates, and when they were filled, we tried to quarantine them for 2 weeks before we were housing them in general population. Masks were mandatory in the jail for all staff. During the shortages of PPE or personal protective equipment, trustees made masks for us. We provided cloth and they would sew them. We provided hundreds of masks to inmates. Many inmates used them, but many used them for other purposes. You'd walk down the pod and see masks covering eyes like sleeping masks. We even had an inmate remove the metal nose piece from his mask and try to slit his wrist with it. I was also working home health. When COVID eventually hit our jail, I quit home health as I was working with vulnerable people. Morally, I couldn't put them at risk, so I could make a bit of extra money as I was also caring for hundreds of people with COVID. I began to work a COVID ward as a second job instead. The stress and burnout was real. I can only imagine what they went through back then. People tried to impose mandates to slow the spread, such as jail time or fines in some areas. People continued to refuse to wear masks. The Red Cross even stated the man or woman or child who will not wear a mask now is a dangerous slacker. Influenza lives in respiratory secretions and objects that have been in contact with sick people or those caring for the sick not taking precautions. Common symptoms of the flu include cough, runny nose, body aches, fever, and fatigue. This strain also affected the lungs and led to pneumonia and pulmonary edema frequently, which is fluid in the lungs. People died basically drowning in their own fluids. The 1918 pandemic was a strain of H1N1 avian type influenza. Influenza invades host cells and makes them replicate more copies of itself. The 1918 influenza has been isolated and recreated in labs. It was found to be a lot deadlier than normal strains of influenza in mice, just like in humans over 100 years ago. It also tended to affect the lungs of the mice more seriously than other strains of the flu and killed greater numbers of mice. In modern times, we have over-the-counter medications to treat fever and other symptoms. We also have antiviral medications such as Tamiflu, which have been shown to lessen the effects and shorten our recovery time when we do get the flu. We also have annual influenza vaccines that the CDC and the WHO try to track and determine which strains are most common this year. Influenza tends to mutate, that is why the vaccine is determined on a year-to-year basis. We also have home remedies such as Vapor Rub, chicken soup, and 7-Up.